Hello everyone, I'm Dr. Veena Aggarwal, Consultant Women's Health, MD MEDTalks and IGCP Group, and Trustee Dr. KK's Heartcare Foundation of India. You're watching Dr. KK's MEDTalks, Wednesday with Dr. Veena Aggarwal, non-stop show 364th episode. A very warm welcome to you all. Let's have the headlines of the day. India has reported 38,792 new COVID-19 cases in the last 24 hours, a 23% higher than the previous day count. The country has also reported 41,000 recoveries and 624 deaths. Delhi recorded 76 COVID-19 cases and 2 fatalities with a positivity rate of 0.11%. Russian Direct Investment Fund, the RDIF, is expecting to release the results of Sputnik V and AstraZeneca mix and match vaccine by the end of July. RDIF CEO informed that high efficacy is expected from the trials. A woman medico from Thrissur, Kerala, and India's first COVID-19 patient, has tested positive again for the virus. Researchers in the US have designed a synthetic defective SARS-CoV-2 that can interfere with the growth of the real virus, potentially leading to the extinction of both the COVID-19 causing pathogen and the artificial one. Prime Minister Narendra Modi, in his interaction with the chief ministers of the northeastern states, cautioned against crowding at hill stations and emphasized on prioritizing practice of COVID-appropriate behavior, vaccine administration, and continuing the strategy of testing for prevention and treatment. Now let's have the topic of the day. Travel and change of place imparts new vigor to the mind and brings power and love back into your life, so said Rumi. Today, we will discuss if we are in a position to indulge in travel for pleasure. Are we headed for the third wave, and what are the new variants of concern? जब से दोबारा वेव कम हुआ, दूसरा वेव कम हुआ, तो लोग अपने नॉर्मल रूटीन्स में वापस आ गए हैं. They seem to have forgotten the fear, the desperation, and the devastation of the second wave. Restrictions भी कम हो गई हैं and revenge travel has started. लोग तरस गए हैं घर से बाहर निकलने के लिए और मानसिक सुकून के लिए अपने घरों से निकल रहे हैं और टूरिस्ट डेस्टिनेशंस में तहलका मचा रहे हैं. Knowing fully well that this kind of behavior and throwing caution to the winds will usher in a third wave. क्या सेहत और जिंदगी की कीमत एक हॉलिडे से कम है? और अगर हमें ट्रैवल करने की आवश्यकता भी है किसी काम के वक्त, तो क्या एहतियात बरतें कोविड से बचने के लिए? To answer all these questions and concerns, we have with us today Dr. Suneela Garg.
Thank you so much, Dr. Veena, for having me on the show. In fact, it's a very nostalgic show for me because, you see, I've been doing a couple of shows with Dr. KK Aggarwal, and I'm very happy wherever he is, kind of. So probably, we are carrying on the show together. So number one, point, it is very, very important issue. What you raised is that, you see, since the time, unlocking has begun in different states of India, what we can say is that, particularly northern states, people have started rushing towards the hill stations, right? And what we see over there is that, not only they have started rushing, there are overcrowded roads, there are overcrowded, hotels, there are overcrowded malls, and there is, totally bizarre behavior of people. I'm myself as a public health expert, I feel so much, saddened at my heart that this is something, the second wave did not teach us this. And what we can see is that, where is the administration? After all, when we see so many people who are there, in these hill stations, and which is also compounded by the weather is not in our favor. So many people, we lost because of lightning. So to give you already pointed out in your facts and figures that we have got actually over 40,000 cases in last, 24 hours. And also, if you would see, COVID has not gone out of our lives. And if, we can see some of the pictures, we can make out that basically how COVID is, can hit us back. And there was a State Bank of India study which was released just a few days back, which said that in the middle of July, we will go around, 11,000 cases and all that. And then in the mid of August, then the cases will start rising again. And then, we will we'll move ahead for the third wave. So that is one of the studies, and that has been also been predicted by economists and all that. And many people have asked me from the public health expert perspective, that what is my opinion with this regard. So that's where I'm there to say that, if we are, what will bring the third wave. The third wave will be only brought by, kind of three things. One is, what kind of seropositivity we have right now. And if I can first see some of the pictures which have been, shot, and then they have to be projected, that would be very nice, and we can take a stock of the situation from there. And I can see that first thing which is there is lack of, COVID appropriate behavior, which will bring that. Number two, which will also, look at how much is our vaccination coverage. Right now we have only vaccinated about approximately, nearing 39 crore individuals, and not total exactly. And then, another thing which is very, very important is that we are stuck in between, where Delta variant is quite very common and has affected so many countries, including our own country in 13 states that is already there. So these are some of the scenarios which put us to point that, are we, really prepared for, preparing ourselves for third wave? Are we really prepared to deal with that situation in terms of, right now, second wave has not gone out. To give you some of the data, which I've got, we have got, still Nagaland, Mizoram, Meghalaya, which have got seropositivity rate, which is varying from 11% to about 15%. And if you will see seropositivity of Sikkim, that is about 20.5%. And then if we see seropositivity of Kerala, that's about 10%. So that is where we see that, still we are in the midst of, infection, and many districts are still, about 43 districts have got seropositivity, which is more than 10%. So that shows that exactly, virus is amongst us. And everybody has to remember that till basically, COVID goes out of the country, it goes out of the world, it does not go out of our lives. So there could be, four scenarios. Either COVID, rises in a big way. Second is, it kind of compromises. Third is it becomes a, kind of in an endemic way it is there, or it becomes a part of our lives, like something like flu. We learn to live with that situation. So that is something very, very, very important. So I stop here, and I'll wait for some of your queries and questions, and then we'll go ahead with that.
So Dr. Suneela is not a stranger on this platform, but for those who are seeing her for the first time, a little brief introduction about her. With an experience of 35 years, Dr. Suneela Garg is currently the Director, Professor, and Head Community Medicine at Maulana Azad Medical College and Associated Hospitals. She is the National President of IAPSM. She has professional and research experience with national and international organizations such as WHO, UNFPA, Population Council, and Rockefeller Foundation. She is a member of the Global Advisory Group of WHO and an advisor to CBM for national and international initiatives on disability. She has been on board of MCI for curriculum reforms and advisor to diplomat of National Board of Examination, and also is involved in capacity building and research related to geriatrics for over a decade. But most importantly, she is from the same medical college as a dear Dr. KK. So, Dr. Suneela, we've heard your view upon what the situation we are in. And absolutely rightly so, you're saying that even till we have even one person who is there to replicate the virus, we cannot let down our guard, because all these new variants which are coming in are so much more infective and much more resistant to the vaccination and the antibodies that we have to be on our toes. The scenes at the hill stations leaves me also totally baffled. इतने सारे लोग, ना कोई mask, ना social distancing. This is a short way of ushering in the third wave. In fact, the third wave might have set in on July 4th, as you said, according to a Hyderabad-based researcher who has analyzed the daily data on new infections and deaths over the last 15 months. In fact, a Times of India report quotes Dr. Vipin Srivastav, an eminent physicist and former Pro-Vice Chancellor, University of Hyderabad, according to whom the pattern of new cases and deaths seen from July 4th are very similar to those seen in the first week of February, when the second wave had started. So what is your opinion on this, Dr. Suneela? I mean, what are we heading for?
See, you rightly pointed out, Dr. Veena, that you see from 4th of July, if you will see the middle of, we were, coming down with the numbers, and we had come in the to the tune of 30,000 plus and all that. Then suddenly we saw the cases, again going up, 40,000, 42,000, 43,000, and all that. And yesterday, when I was looking at the data from Kerala and from, Maharashtra, and also from northeastern states, the R naught of these states, in fact, has gone, particularly when we talk in context of northeastern states, it is already above 1. And from Kerala, if we look at R naught, that means, number of infections which can be transmitted by one person. So that is where, when we see R naught of Kerala and R naught of Maharashtra also, that is already inching towards 1. And if the moment it crosses 1, there, we are into trouble. Because you see, if you look at some of the cases, if, for Kerala, we have got up till now 163% total increase in number of cases since 10th March. So this is how the situation is. And in some of the states, when we talk of northeastern states, when we talk of Tamil Nadu, when we talk of, some of the other states like Bihar and all, it's actually every state is a country. So you see a different kind of a scenario in every, state, because we have a rural and urban background in each. And now you see, we are seeing cases from the rural areas as well, where, we have got limited testing, we have got vaccine hesitancy, which is very, very high. And we see that COVID appropriate behavior has gone for a toss. But, of course, we can see that rural area, of course, we condone it of looking at people do not have adequate knowledge, or people, cannot maintain social distancing, or the social milieu is that, or overcrowding, or, we can see that number of people who are there, per square meter, overcrowding is not that much in rural areas. The environment is quite very open. But when we see at the urban elite, or so-called middle class elite people, who are knowledgeable, so-called knowledgeable, but then they are aware of all the consequences, and they have been quite maximally struck. We have not forgotten the scenarios, particularly the overcrowded scenarios. If Ritu can show us those scenarios, that will be really, kind of, it will be, we can recapitulate that, with lack of COVID appropriate behavior, or, no social distancing, the malls being so very full, as if, there are withdrawal symptoms amongst people, so जैसे हम कहते हैं कि जान है तो जहान है, अगर जान ही नहीं है तो जहान किस बात का. तो that is where we have to see very, very carefully that, we are there to enjoy this if everything is okay. People have forgotten over a period of time the sacrifices which have been made by healthcare providers, particularly a very close friend like KK, who had an OPD of over 1 million cases, I'll see overall over a period of time. So you see, people should not forget that healthcare providers have sacrificed their families, they have sacrificed their lives, for what? After all, so that we can see a better tomorrow. So that is where importance is, that we should not lower our guards and all that. Though the government is telling that, we should be having, while visiting the hill stations, day before only 8,000 people were turned back. The earlier picture was, basically that, it's about 5,000 people were turned back. But actually, when I spoke to, the hoteliers from Manali, and I talked to them, who was the leader of Manali Hoteliers Association, he said, Madam, 50% occupancy. I said, how do you say so? Because you see, now people, the numbers, what they are there, what we can see over the malls and all that, it is very, very, kind of, I'll say, scary situation. And these people are being accommodated in hotels and all that. So that's where I don't think the numbers are appropriate to say that. Any kind of super spreader event at this point of time needs to be taken care of, and it needs to be kind of avoided. So that these are my initial remarks. And if Ritu, you can show us some of the pictures, that will be good. And in the meanwhile, I can read one question. Dr. Madams, those who have already got COVID infection, they need to take care of vaccination, because as they need to take vaccination because they have natural immunity. Please suggest. No, basically every person, unless he's been infected in last 3 months, they are supposed to take the vaccination in 2 doses. Right now we have got 3 vaccines. One is Covishield, another is Covaxin, and the third is Sputnik vaccine. So these 3 doses vaccines are available with us, and they have to be taken at, both the doses have got to be taken as per prescribed norms. Like we say that Covishield after the interval of 12 weeks, and Covaxin with the interval of 6 weeks, and Sputnik at the interval of 4 weeks. So that is where we need to see that everybody, Garija, needs to be taking the vaccination, because right now we have got vaccine as the only answer to the situation.
So obviously, travel is playing a big part in spreading the infections from one state to the other. We don't have any cap on domestic travel. I don't know, should non-essential travel be allowed?
Very, very important question, Dr. Veena. That you see, not only essential travel, particularly for elderlies and all, we say that non-essential going out of the house also is not required. And the offices still, many of the offices, particularly in private sector, they say that you work from home, you need to come to office as and when it is required. So, and particularly in offices also, we say that don't have the lunch together and all. And if the people are traveling, outside, moving to the hill stations or going out, then over when we start doing all this, then something, basically what we forget, during that point of time, is that we need to wear our masks above the nose, below the chin. Second is that we need to maintain the social distancing, which is hardly possible. The third thing is also we need to see that we need to do sanitization and all that, which gets compromised while we are traveling. Now look at this first picture of Manali's Mall Road, which is, kind of, a number of people, you can see that, and this is, of course, I'll still say that this number is still not that number, but it makes me still very scared. And what pictures which I have seen of today, nearing my house in Noida market, there is no place to keep, feet. And here you can see that, gathered at the ridge and, and Simla. So kind of, I really am surprised that you can see that, half of the people, those who are wearing masks, where is the mask? Kind of, they're wearing masks for namesake. And another thing, Dr. Veena, what I like to add is the studies have shown in India that only 50% of the people are wearing masks across, and only 15% of them they wear correctly. So that is so that means we can do away with 85%, which is a huge chunk of our population, which is almost 1.38 plus crores. So that is where we can see that, of course, we can even spare our children who are less than 5 years of age, and which comprise of 17% of our population. So still you can say that rest of the 83% of the population, and if we are not wearing, how we will see that the children will see light of the day in form of going to the schools and all that. And this is again another situation. I think it is the clock tower where you see near, and such a beautiful place, but you see, now it makes me feel scared that if this kind of behavior is there, where are we going to go? And the same people, the same families, they were fighting for bed, few not only, I'll say, it is hardly a month, they were
Absolutely.
running for the oxygen cylinders, they were asking for different medications and all that. So I feel that somebody should remind them again and again. But also another thing what worries me is that where is the administration? I cannot see, what they have also said that, you see, it is not only the individual's responsibility, it is the administration's responsibility as well, to make sure that people are not crowded like that. They should restrict the entry. They should see that the fines are imposed on the people who are not following COVID appropriate behavior. So these are some of the things which we must keep in mind. And to put it into perspective, yesterday you rightly pointed out, Dr. Veena, that Prime Minister had a meeting with the chief ministers of Northeast, and I already told you that in Northeast we do have very, very high prevalence of infection, particularly in form of high seropositivity and all that. So
that
when we see all
when we
this,
see all this,
so the thing
so
which
the thing
bothers is
which
that
bothers is that,
that you know
you know,
there also COVID appropriate behavior is not there. This, another thing is number of cases are very, very high. So we need to take into consideration. And Prime Minister, what did he say was that third wave will not be coming on its own. This is the way we are inviting the third wave. So it will not tell us and come that I am coming.
I'm
This
coming.
is where we
This is
need to
where
follow
you need
COVID
to follow.
appropriate behavior.
So obviously, these pictures that you've shown are from India. We've seen some similar pictures from Wimbledon, from the Euro football games. So it's not just here that we are having this problem, it's world over. America has, of course, opened up everything, and they're saying there's no masking needed if you are, vaccinated, fully vaccinated. So authorities have become complacent. If it is absolutely necessary to travel, what are the precautions that one should take before, during, and after the travels?
Definitely.
Definitely,
There is a echo
there
which
is
is
an
coming.
echo which is coming.
So what you really asked me another question is that what are the precautions? Now we are in a committee which is deciding the or drafting the guidelines for international travel, local travel, which is by train. The second part is that we need to look at the travel by buses and by cars and all that. So definitely if we see that when we are traveling by our own mode, we are having our family and all that, so we can create a bubble like situation. So those 5 people or 4 people who are traveling together have to wear masks, as I told you, and double mask the moment you are stepping out of the house. You have to follow that. The second part is that within the car also you need not sit very close together, and the windows of the car should be rolled down. That is another important thing. Then whenever you are stopping on the way to have any tea, snacks, or whatever, so people should be sitting at a distance, and by rotation they can have that. So that is one way of looking at that. Now another thing is that when we people are traveling by common buses and all, and we all know that the government has permitted now buses with about almost 50% occupancy and even less than that. So that should be complied, and that is where the role of administration comes in, to check and put heavy fines on the cars, on the personal vehicles, on the travel vehicles which are really full. And that is where people should be taken to charge, and that is another very important thing. And whether the people who are so called the messengers of change should themselves also be following that. So that is where the role of administration comes in, to check everything which is related to COVID appropriate behavior. They should check the hotels, they should check basically the masking and all that. The third important part is that vaccination part. Right now we are not checking for vaccination as far as local travel is concerned, but for international travel, that is your vaccination certificate has to be attached to your either the passport, or it can be be attached to your Arogya Setu, so that can be checked at the airport. And as of now basically, as I'm telling you that primarily everybody is supposed to take doses as per the country schedule, and right now Covishield is there in our travel this thing. Very soon we will be getting Covaxin also in the certificate, so that will make a difference in the travel. But how to travel, there
Travel.
are
There
guidelines
are
which are
guidelines which are,
just put the echo down. So there are guidelines which are meant for. Can you hear me?
can you hear me?
Yes.
So there are
So
guidelines
there
which
are
have been
guidelines.
drafted for the outside airport. The moment you are entering the airport, for the airport officials, then we want to. There are guidelines which are being drafted for the passengers, for the crew members, for the people who are shopping at the airport, and for the eatery shops and all that. For each level, the guidelines are there, and also how to board the plane, deboard the plane. So those guidelines are already there. And then the last important part is that whenever one is issuing the tickets, middle seat preferably should not be issued. So then and the crew staff is required to wear PPEs and all, depending on the flight, which is a domestic travel or international travel. And the food also, the whether the food at short distances should not be served, that is as per now the guideline is there. For international travel, the bubble is being proposed. And so, there are many facets to it for the travel. But one thing which is very, very important is self empowerment of the individuals. That is most important. That if I am knowledgeable, I must put all these things to the practice. And then the guidelines for the administration is that they must check for RT-PCR report. And if people are not, kind of coming with the RT-PCR report, the RT-PCR should be done. Let them wait for some time. That is there. But otherwise, if there is a facility like, or there is a place like rural area to which the people have traveled for a holiday or something, there we have got facilities of rapid antigen testing also, so that can be done over there. But one thing which is very, very important is we should not rely only on temperature, because people are very smart. They will take a tablet of paracetamol and go, and so that is something which I don't believe. But symptoms are also very, very important markers. So these are some of the things which I would like to point out at this stage.
Imposing that they need an RT-PCR?
I can't hear you.
Okay. Hello, Ritu?
Yeah.
Can you hear me now?
Yeah.
I was saying that what is the current procedure as far as the RT-PCR? What is the requirement for the RT-PCR for every state? Are they making it compulsory for an RT-PCR before travel?
You see, earlier it was there, but now gradually they are doing it. But I feel that this is the time when they should be imposing it. They should be more vigilant. As I told you that, particularly when we are, it depends on the area also. Where we are, there is low positivity and all that. So but still the person, should make sure that before traveling, he or she may be asymptomatic, but still may be carrier of infection. So that is where the role of comes, if he or she has not done, so then, rapid antigen test becomes very important.
So we were talking of different modes of travel, whether by a plane, a car, a bus, your private car, a cruise. A cruise is very close to my heart. So which is the safest form of travel?
See, every form of travel can be made safe, provided we are following COVID appropriate behavior, social distancing, and if we are vaccinated. That will make very, very distinct. Another thing is that if one is suffered from infection, then important thing is that one should not take a travel at least 30 days, just after the infection. So that will make the travel safer. During the travel, one should vigilant every time that we are following the COVID appropriate behavior, and simultaneously we should keep in mind that others also follow the COVID appropriate behavior. Only thing who can be exempted are children who are less than 5 years of age, who cannot wear masks. So that is where we are not able to impose on them, because the guidelines of Indian Academy of Pediatrics are also like that. And let me tell you, Veenaji, that another thing which is very important is that right now children who are coming to the pediatrician, they have not learned to speak. They learn to kind of only signing. They're talking only signing. They have not heard their parents talk because they're working at home. So these are some of the important things which we have to keep in mind, that children have to go to school. How schools are going to open? The schools will only open when teachers are vaccinated, children are safe, and we have fair confidence in the system.
मैम सॉरी टू डिस्टर्ब यू वीना मैम आपका है ना माइक म्यूट रखिए जब सुनीला मैम बोल रहे हैं बिकॉज इको आ रहा है आपके एंड से सॉरी
So let's take one question. Rashmi says, ma'am, what about people who have been vaccinated for nearly 6 months? Are we more vulnerable?
See, everybody following vaccination is also vulnerable, because you see, breakthrough infections are quite common. We have conducted one study in the healthcare workers, And we saw that breakthrough infections after one dose was to the tune of about 20%. That means amongst the healthcare workers. And also amongst people, who have been vaccinated for 2 doses, 9% of them, they got the infection. So, but then, we can say that healthcare workers are, basically at the high risk also. They're seeing that. But then, we have still given the instructions that even at the booth, where you're taking the vaccination, you must follow the behavior. After taking the vaccination, COVID appropriate behavior has to be followed. And if you get some signs and symptoms, you must isolate yourself immediately. That is another important thing. Veena, you're muted. You're muted.
When there's so much crowding as we saw in the hill stations, what is the point? Is there any point of a COVID appropriate behavior? There's so much crowding. How do you maintain social distancing?
Dr. Veena, very, very valid question. And this is where comes the role of administration. We have to see that how much crowd a particular hill station or particular holiday destination can accommodate. So this is where if we have only that kind, we have kind of opened up, but we have not opened up so much that we can there is no place to even keep your foot, you're just neck to neck. Or you were seeing that the match which we saw in England. So the kind of scenes what you were seeing, hardly not even COVID appropriate behavior, but the kind of rush or crowd. So that is where people say that if they can do, we can do. So that is where, but then here comes the role of administration to see that they are able to regulate the crowd, they're able to see the RT-PCR reports, they're able to cut the challans. And we should avoid any kind of super spreader events. Super spreader events means any kind of gathering, any kind of religious events, any kind of, we have got appropriate numbers and we should follow those numbers accordingly. So that is where if there are 20 people who are required, so 20 people should be attended. If there are 50 people required, but then they should all follow, the precautions. And another thing is that must, finish with that procedure as soon as possible, so that, we can protect ourselves, we can protect others also. Muted, you're muted.
Ritu, this is very irritating. So travel contributes a lot to the economy of the country. So it is a double-edged sword, right? People are sick of sitting at home. They are mentally disturbed, so they feel that ab jo hoga so hoga. Let us at least be sane and just get out and travel. So it's a double-edged sword. Should we travel? Should we not travel? Should we sit at home? Should we go out? I think people have reached a state when they're saying to hell with everything. अब हम पागल ही हो जाएंगे घर में बैठे बैठे, तो हम क्या करेंगे किसी चीज का. So they have to understand that ultimately what they are playing against is life itself. So the travel industry is also feeling the brunt of all that. So how do we, I think vaccination is the only answer, but we seem to be running short on vaccines.
Dr. Veena, your question is very valid. And what you said that basically we have to, ghar mein baithe baithe naturally, depression or, mental health issues, they overpower you. And you have not seen the light of the day for so much of time. So you definitely need a change. But then we have to decide in what form we need a change. Do we need to go to a nearby place where we can come, which is not very crowded? Because nowadays on net one can search very, very easily. It's not that we saw that everybody went to Manali or to hill station and then there was a jam on the road itself. Kind of that is where comes the role of administration. And one can see that these are the destinations which are open for people, so they can come over there. And so India is so very big. So that's where we need to see that we have to look at that part of it. Because again, I also feel that, health of the individual also is very important. The change is required, but in what form the change is required and in what manner, that needs to be taken into consideration. So we need to follow that. And again, we should go to, right now, we have got all the, every day the data comes, of different states. Something like to tell you that if I look at the Uttarakhand, there is zero positivity. 0% seropositive. That means we are not getting any cases and all that. And their vaccination percentage is about, if I was to look at, it is about 49% of the people are vaccinated in Uttarakhand. So, people will like to go to Uttarakhand, but there is a percentage of population which can go to Uttarakhand. So that is where comes the role of administration, that okay, they can announce that 6,000 or 10,000 people can be permitted over this much period of time and per day. So that is where the administration's estimates will do. We cannot decide that for the administration. From the public health perspective, I'll say that this is where the role of administration is, that okay, for this much period of time, these many people are allowed, but more than 4 or 5 people, not related to each other, cannot crowd at a point. So that is one thing which is important. Then we can see that, again, to give you some of the figures, if we can look at the picture of Himachal Pradesh, again seropositivity is about 1%, and 64.34% people are already vaccinated there. So but then if we look at the if we look at Simla Mall and all that, the kind of pictures what we have got there, again comes the role of administration. So we need to look at from that perspective, and we must be very, very cautious. As the PM already pointed out, that we need to prevent third wave. That is in our hands. And how we can prevent third wave is one of the important things, is that about the behavior part which I've been talking. Second is to maintain the we cannot close the place. We have to maintain the micro containment zones even at these places. Of course, the places which I mentioned have got a very, very less seropositivity, but then wherever there is positivity, we have to maintain the micro containment zones. The third part is there also testing, treating and tracking has to go on. And the third part again is vaccination and vaccination. That is another part. So I always call it as MTV, that means masking, testing, treating and tracking, and V is your vaccination. And plus we complement with our appropriate behaviors. You are muted, Veena. Dr. Veena, you are muted.
Sorry. Pavan Gupta ji is asking, people who have taken 2 doses, can these individuals sit together without a mask? So according to the United States and the CDC, they say that if you've been vaccinated, you can meet without a mask. But I am a victim of a reinfection and a breakthrough infection. So I'm still wearing a double mask, even if I'm meeting people, because reinfection is a reality. What do you have to say, Dr. Suneela?
Dr. Veena, one thing which is very important is that we are different from the rest. If you will see our own houses, we have got house help coming. We have got, other people who are coming day in and day out. We are not preventing them from coming. And they come from, they come as in form of house helps and all. The situation is different as compared to America, where there are only 2 people or 3 people. So it's a kind of bubble-like situation. But then again, CDC also is predicting, because Delta variants are coming, they are in large numbers in Los Angeles and all in West Coast. So they also might have to, go back to, revisit their, COVID appropriate behavior. And the second part is they are also thinking now about, again, restarting the vaccination campaign. And also we saw today pictures of Russia also, where, they have started in a big way vaccination of young people also. So every country has to still, keep in mind from the public health perspective that virus is amongst us. It has not gone out.
So when you're talking of the young people, the children who have not been vaccinated, though there's been a study in our country which says that 60% of children in Delhi are seropositive, but it is still very risky for them to be traveling with their parents.
Yeah, definitely, because we don't have any vaccination for them as of now, and vaccinations are under trial. But then, what is important is that children, as of now, they don't need vaccination, because in wave 1 and wave 2, we saw 3% of people under 10 years of age, they got the infection, and 10% of people between 10 to 20, they got the infection. So 3% under 10 and 10% between 11 to 20 years. But infections were milder in nature. So, and right now the vaccines are on a trial phase. Covaxin is under trial. So Bharat Biotech is doing the trials, and then also we are having, other companies like Moderna and all who are doing the trial. So, and Zycovid D is also doing trial for children. So as soon as available, but then we should start with children who are, we should go downwards. We should go downwards from 18 years to 12 years of age.
So there was a talk about EU countries not recognizing Covishield. What is the status on that?
See, on that, now the status that we have allowed, on the reciprocate basis, because the government of India also said that we will be putting more people into quarantine. So that has been now fairly taken into cognizance by European and other countries.
But there are some countries who have allowed travel, like Germany, Switzerland. If you have proof of vaccination, then they are.
Yeah, that's what I said. That's what I said. Reciprocated. So they have said that on a reciprocated basis. Otherwise, they are heading for trouble because we will not recognize their vaccine. They don't recognize our vaccine. So these are, from the political perspective, these issues become important.
So what about the student? Now there's going to be a whole student rush to the foreign universities. So how are they going to be allowed? Do they need a full vaccination as certificate? What is
already the travel is started for these children. So then they are, right now the only option is to see that they are vaccinated. The second part is also that not only they are vaccinated, but another thing is that they make a kind of a bubble in the aircraft so that only these children are interacting. And when they go over there are quarantine norms. So which have to be, and then before traveling, before 72 hours, they have to get their RT-PCR done. But if they are, showing some symptoms, they are again subjected to the test at the airport. So that is one thing which becomes important, and their vaccination certificate gets tied up to the passport.
If somebody, for somebody who is just recovered from COVID, how long after that is it safe for them to travel, or should they not travel?
At least 30 days.
Okay. So that will, of course, be the domestic travel, because for foreign travel, they would require the vaccinations.
Yeah, but then, policies are also varying. We are giving after 3 months the dose of vaccination, after the infection, because infection gives you immunity. But WHO says you take vaccination after 6 months. So that is where you can produce your antibody certificate. That will be.
And also one last question on, is there a talk about a booster dose?
Yes.
And if so, after how long?
That will be, we come up with that, because right now our priority is to get 2 doses of vaccine. So right now, booster is in our mind. The companies have restarted looking at their own vaccination also. But whether this will be effective variants of Delta variant or Lambda variant or any other variant. So that is where we are looking at that. The companies are looking at that. The booster comes, at a point when, we have vaccinated enough number of our people. That is also in our way of discussion.
And so, do you have an insight into what the vaccine status, the supply status is in our country? Because we hear that Covishield, in today's news it was that Covishield supply has run out. So what's happening there?
Right now, what is important is that it was already predicted that this month we will be vaccinating about 12 crore individuals. Okay. So then, from August mid, we will be raising our line. And you must have heard that India has also signed up a contract with Sputnik, and Sputnik is going to supply 30 crore doses in about a year's time. So if we look at the December scenario, by December, we'll be having 50 crore doses of Covishield, 40 crore doses of Covaxin, 10 crore doses of Sputnik. Then we will be having 5 crore doses of Zycovid D, and also more than 10 crore doses of biological C. So that is where our supply is going to be like that.
So they say travel opens your heart, broadens your mind, and fills your life with stories to tell. But in today's scenario, these stories will have to wait as you have to be alive to tell these stories. Thank you, Dr. Suneela, for joining us today and giving us an insight into traveling and the third wave in these troubled times. As a token of appreciation, we would like to give you a certificate. Ritu, please show us the certificate.
Thank you so much.
Thank you so much. Thank you. Thank you, Dr. Suneela. Thank you. And that will be all for today. We will be back tomorrow, but an hour later at 8 p.m. with another edition of the show. Keep watching Dr. KK's MEDTalks. Namaskar.